Well, I'm here with James Baker, Commissioner of the Vermont Department of Corrections. Good morning, Jim, and thanks for taking the time for this interview.
Hey, good morning, Scott. Thank you for having me.
Jim was the 2018 Hogan Award winner for his exemplary service in different facets of the criminal justice system in Vermont. He was appointed as Commissioner of the Department of Corrections in January of 2019, just before COVID-19 consumed our lives, and I'm sure his over the past year. I know that Hogan would be delighted to know that you're appointed a commissioner, having served in that role himself. Jim, what I want to do is I want to prompt you with some of the tenets of the Hogan Award and ask you how you applied those in your work with COVID-19 over the past year. And you'll remember that those are focusing on results, using data and measurement to mobilize action, working with people across diverse perspectives, taking risks in pursuit of a vision, and persisting through setbacks. So jump right in and tell me where you want to start.
Yeah, I guess, well, first of all, Scott, it was January of 2020, not 19 when I started yet.
Sure.
Well, look, I came in an interim role. I was asked to come for 4 months, and 17 months later, I'm still here. And a big part of that is because of COVID.
Yeah.
COVID was a real challenge for us. We really leaned on data in a big way. Not only did, under the leadership of the governor, push the commissioners to use data, but we've been using modeling to kind of give us a sense of where our danger zones were in the facilities. Across the country, we led the country in many ways. We never lost anyone inside a facility from a death, unlike the other states in the country. And a big part of that had to do with data. And the data that we used also was driven by we test to suppress. We tested more than probably any other jail system in the country. And that allowed us to get ahead of any of the outbreaks. When you talk about setbacks, we had several setbacks. We had a couple fairly significant outbreaks in our Northwest facility and a couple of the other facilities around the state. But we also had a very large outbreak in the Newport facility, positives. And, that was real setbacks for us because the protocols we had put in place followed science. We were adjusting the protocols almost on a daily basis. When I think about the tenets of the Hogan Award, we took some real risk in some of the protocols that we implemented. Early on, we shut down visiting and people coming into the facilities. That may not sound like a risk to folks, but the risk was that tends to get the incarcerated population upset when they can't see their loved ones. And to their credit, and to the credit of the folks that work for corrections on the ground, we had very few major events during COVID. So those are some of what we had been working on over the last year as part of what Hogan's legacy inside corrections is.
Tell us a little bit about how did this open up any new partnerships working with people during the COVID? Did it change any relationships for you?
Yeah, I think we became very, very close with the health department's EPI team in contact tracing, and the learning that went on inside the organization is phenomenal. And I think the other thing it did, although this wasn't external organizations, one of the challenges that I saw when I came to corrections is just because of the nature of the organization, the communication process, this really broke down stovepipes inside the organization because we had to communicate. So not only were we communicating internally, but we are communicating externally. And then we built really close relationships with the folks at the health department. And we also, I think, enhanced our relationship with the advocacy community who advocate for incarcerated individuals. We had to communicate with them on a regular basis about where we were in the process, and with the ultimate goal of protecting people from real harm from the virus.
And how do you think that will change practice or policy going forward once we get beyond the pandemic?
Well, it's kind of interesting because I came from the outside to corrections, not really knowing the culture of the organization. And what folks tell me around me is that, first of all, we are communicating better than ever. And you would think, well, we haven't been able to be in person, but our communication process now is stellar. We set up the incident command system to run the response to the pandemic, and the communication's incredible, number one. I think going forward, it's going to help us communicate better. Number two, we really saw folks that may not have been in the view for leadership positions in the future really step up and lead. And I have a saying that every day is a job interview, and a lot of folks really stepped up and demonstrated their leadership skills during this pandemic. So I think those things are going to help us be stronger moving forward as an organization.
That's great. Great to hear. Let me ask you, you had some goals back in 2018 when you got the Hogan Award, and some work that you wanted to do to mobilize part of the system. Can you tell us a little bit about where that's at?
Yeah, just as a reminder, when I accepted the award, I talked about a focus of mine was wellness of first responders. And, shortly after accepting the award, it took me some time to think it through how this would look. And during the summer and fall of 2019, we pulled together a working group of first responders throughout the state, really tested this theory that I had that not all first responder communities get access to mental health support as a result of exposure to trauma and stress. And it validated that my thoughts were spot on. And one of the first goals was to hold the first ever first responder wellness conference, which we held on December 9th of 2019. And I had no idea at that time that my phone would ring 3 weeks later, asking me if I would be the interim commissioner of corrections. And corrections was heavily involved in that conference and that planning process. We held the first conference, hoping that we could hold another one. Of course, the pandemic hit, really full steam ahead in March of 2020. But we continued to work on the development of a bill to form an emergency service provider wellness commission. Of course, 2019 was the second half of a biennium. The COVID kind of took over in 2020. We didn't get the legislation through during the session in 2020. But this year, working with all first responders, it was amazing to watch walls break down and people work together. The testimony at the legislature, every time we would testify, it was just a sea of different organizations supporting the concept that there was more need to balance out and level the playing field for first responders to get access to wellness support. And I'm proud to say that Senate Bill 42 was signed by the governor last week. There is now an emergency services provider wellness commission, and it covers everything from EMS workers, the firefighters, the police officers, the 911 call takers, the dispatchers, and to include the Department of Corrections. And that commission will be up and running after July 1st. I think the legislation directs the first meeting to occur in the fall, and the focus will be education, advocacy, research, and development to better identify ways to support the first responder community. And it's so needed now after what the first responder community's been through as a result of the pandemic. And the stories that I heard through this process about people that struggle through out there doing the work every day and potentially being exposed to the virus. And so I'm very happy about that. And it was my overarching goal coming out of the Con Hogan
Award. Congratulations. It's quite a testament to your tenacity to stick to it.
Well, let me tell you something. There were a bunch of people that helped me that, especially once I started on this journey as commissioner, and I was able to support it as the commissioner with the support of Governor Scott, and I'm appreciative of that as well.
Great. Let me wrap up with just a final question as we think about Khan's focus on results. Everything was about, so what's the data tell us about results? When you think about the past year and you think about one or two, maybe a handful of results that really stand out for you that were good markers of how we move through this, what would they be?
I think the fact that we're coming out of this pandemic, we can see the light at the end of the tunnel now. And through the hard work of the staff here at Corrections and the protocols we put in place were cutting edge based on the data. We did not lose any like other organizations around the country. And I'm really proud of that. And I'm thankful for that. And we didn't, no one in our custody passed away as a result of COVID. And I'm thankful for that. And there were so many other, you can see the culture of the organization changing as a result of this challenge that was put in front of us and the tenacity of the organization. And those are the highlights of the past year for me, Scott.
That's great. Thank you, Jim, and congratulations again.
Thank you.
Been a pretty remarkable journey over the past 50 months.
Well, and how ironic it is that I, not knowing when I got the Con Hogan Award, that I would follow in Con's footsteps as the Commissioner of Corrections. It is an amazing story when you think about it.
That's right. It certainly is. Great. I think we can call that a wrap.
Great, Scott. Appreciate your patience this morning.